Good evening, everyone. Namaste, and welcome you all for third virtual IC Nursing Innovative Forum. Today's webinar theme is Transformative Leadership, Paradigm Shift in Nursing. We have two eminent speakers to speak on this topic. As we have heard, if your actions are inspire others to dream more, learn more, do more, and become more, you are a leader. So we have such leader amongst us, and our founder of this IC Nursing Forum, we have Surgeon R. Admiral V.K. Singh, Managing Director, InnovatioCuris Private Limited. He's also a chairman of InnovatioCuris Foundation of Healthcare and Excellence, adjunct professor, World Health Innovation Network, Poitiers School of Business, University of Windsor, Canada, visiting professor of Indian Institute of Management, Indian Institute of Technology, and authored a book, Innovations in Healthcare Management, Cost-Effective and Sustainable Solutions with National and International Authors, published in USA, past Director of Healthcare Asia for Lean Healthcare Excellence, Simpler, and Chairman of Board of Indian Society of Health Professionals. Dr. V.K. Singh is the Managing Director of IC Nursing InnovatorFORUM. Thank you, sir, for creating this forum. And I must speak a little bit about this forum for the audience. The forum mission is to support and engage nurses in area of practice, research, leadership, and scholarship, while creating an environment in which professional nurses can share knowledge and support the learning empowerment and professional development, and are committed to make a difference and improve the care of population in the Indian community. How this will help the nursing and other people to join, if they join, how this is going to help this forum. Exchange of information with other senior nurses or healthcare specialists, expanding your knowledge from most experienced nurses, awareness about nurses' experience in other workplace, awareness about nurses' experience in other areas of working, promoting yourself for professional purposes, an excellent marketing platform. How the benefits of the membership. You can be a speaker. We can nominate you as a speaker. You can participate in any event taken by the Innovative Nursing Forum. And you can save 10% on all activities and events organized by the forum. Your free promotion of member business on our monthly newsletter, which reaches around 95,000 plus healthcare stakeholders. Networking opportunities at partnering events of ecosystem members, club meeting, ICFHE hosted events you can participate, exposure to innovations in healthcare, and special discount on nursing training and webinars. These are the benefits of taking a membership. With a small note on the introduction on the Nursing Forum, let me introduce the moderator of today, Captain Sunita Fernandez. She is the Deputy Nursing Director, Ruby Hall Clinic. Captain Sunita Fernandez, she's an alumnus of prestigious Armed Forces Medical College, Pune, was commissioned in 1991. She completed her master's in OBG from Kelly Institute of Nursing Sciences, Belgaum, and she has worked in clinical, academic, and research activities in various hospitals as well as colleges of nursing in India and abroad. She has presented various research papers at the state and national level. She is a recipient of the TNA Award for the Best Nurse Administrator for the year 2015 and 2016. She's a member of various professional organizations like TNA, SOMI, CCNS, and INS. She's driven by the quality patient care, education, and research by being a part of the medical fraternity in bringing about changes in society. She's a member of AWWA and conducted a planned teaching program on menopause among wives of Jawans of MLI posted into the border area. Presently, she's working as a Deputy Nursing Director at Ruby Hall Clinic, Vanavai, Pune, Maharashtra. We welcome Captain Sunita Fernandez. I hand it over to you now, the complete webinar session. Thank you so much for being here and agreeing for being the moderator of today. Thank you.
Thank you, Lavanya, ma'am. Thanks a lot. It's a great pleasure and a privilege to be here today on this platform. And I can see that there must be quite a few of us who are quite senior in this profession, and we've gone through this from, like, I got commissioned in 1991, And since then, it's been a long 30 years of service that I've worked all over India and abroad. We've seen the practices. And I can tell you that the topic for today, transformative leadership, a paradigm shift in nursing. I guess the meaning, the meaning of transformative, we all know, is transformation, something new. All of us want to see something new, right? So we are looking for something that is there, what we are seeing in a good leadership. We have wonderful leaders all over in our profession, and we want to see a new leadership coming up where there'll be a paradigm shift, where there will be a big change that we are looking for in this profession. We see that transformative leadership is like leaders who motivate their juniors, leaders who set priorities, who ensure everyone on the team understands the importance of his or her work and feels valued. So by this, our nurses are empowered. So empowerment in nursing is something that we look forward in the days to come. As leaders, we need to listen, show empathy, and incorporate input from all stakeholders into their vision, supportive leadership, personal recognition, which can be measured. So, why we feel that is very important, this transformative leadership, it was started by James Downton in 1973. So, he found that when we work in groups, like nurses work in smaller teams, in groups, and we work with many people as team leaders, and we are facilitators. So, but thereby we can improve the nursing care, the quality of nursing care, the patient satisfaction, and thereby even lower the patient mortality rate and better patient outcomes. So thereby, with this topic in mind, when we find that today, as leaders, we find it is a real challenge. It is not very easy to motivate young minds to join nursing, first of all. And even when they are doing this profession, they find that they are not like, there is a gap between theory and practice. Sometimes they find that they cannot practice what they have studied in their colleges. So they need hand holding, they need their seniors to motivate them to work, so that they are envisioned with the vision of the company, of the hospital, the organization that they work in. And their leaders keep them motivating. The organization improves, the teams improve, the quality of care improves, and the employees feel valued for the work that they do. So keeping in mind with this team spirit, patient safety and care, productivity, and thereby there is job satisfaction. We can see that there is so much of attrition of nurses nowadays. Like, this is like a burning topic that we're all discussing about in all forums in nursing. That we find that most of the nurses are going abroad. We are training them here. We are motivating them, but they feel that they are in a better environment where they are happy to work in, where they are valued for their job, and maybe also the monetary gains that they do enjoy. So we as nursing leaders, I think all of us, we need to be a very good motivating factor, be competent enough with our jobs. And also we need to see that junior staff, junior nurses are good communicators. You should be able to, there are a lot of conflicts that do happen. So as a leader, you have to be charismatic, you have to be fair, problem solving, and you have to value each and every person in your organization. Because in nursing practice, you see, when nurses work in teams, they ensure that everyone in the team understands the importance of his or her work, and they have to feel valued. The nurses that are empowered, they can use critical thinking, maintain a positive workforce. So these are the transformation really helps in hospitals where we work as good healthcare workers. And also we find that leaders need to be knowledgeable and have to have a strategic planning. If you have a strategic planning, you can plan the care that as caregivers, how they are supposed to go about. Nowadays, we find after COVID, most of the students are new to the clinical side. So they have, like we are facing every day. So they have to start like how to, approach the patient, how to talk, how to communicate, and start with the basic procedures. So like with basic care, as leaders, we can encourage them. All the activities which are done in a proper way, sorry, they have to be encouraged and appreciated for their work. Most of the time we always make them feel that, oh, you need to learn better, you have to be trained better. But when we take the onus on us, it is, let us deal with it today. What is there, what we got at the table post COVID is a challenge. So we have to face the challenge, we have to take it on our shoulders as leaders and face it head on. Today we are finding that many of them are not motivated to work if they do not have a positive work environment. So thereby, I feel that as leaders, we have to, as during our daily roundings or multidisciplinary hurdles we have. So during all these kind of activities that we do have, we as leaders in our workplace, we have to ensure that each and every member of the healthcare team, especially our nurses, from the juniors to seniors to the middle level, we encourage them, we appreciate them, empower them. When there is an emergency, how do you deal with an emergency? How do you make, how do you call for help when you are in need of a code blue? All these things, if they are given adequate knowledge, a proper induction, proper, like responsibility and accountability for their work, I'm sure we will develop a good workforce and a very good, nurses who are intelligent, who do the critical thinking, and who find solutions to the problems that they face in each and everyday life. So keeping this in mind, with this, I'm sure we, as in this topic of today that has been selected as a transformative leadership, I'm sure that all of us, as we will put our best to make and feel that, make our juniors feel that they are needed, they are required, and they are an important member of the healthcare team. So with this in mind, I would like to introduce our first speaker, Berlin Gayatri. She's a, I'll just read a little bio. She's trained from CMC Vellore and also did a master's at MIOT, Chennai, and also MBA in hospital administration. So she has worked in various appointments in plastic surgery and burns unit in Vellore. Also with the liver transplant and multi-speciality wards in Apollo. They were also in Kaveri, Chennai, and Fortis Mallard Hospital, Chennai, hospital-wide as a chief of nursing. And presently at Fortis MSOG, that is Medical Strategy and Operational Group, at Pan Fortis Manager Corporate Nursing since 2001. She has also a vast experience in JCI accreditation, NABH, ISO for environment, CII for healthcare industry, presented projects in Kaizen, and been an internal assessor for ISO 9001 and 14001, been an internal assessor for NABH, completed NABH and entry-level assessors course, and also she has a lot of training and simulation techniques, and with CAHO, she is professional member of Infusion Nurses Society, member of ANI, member of CMAI, registered nurse and midwife, and also has done a lot of paper presentations organized by Coloplus on wound management. So over to you, Merlin.
Captain Sunita, for the brief introduction, and thanks to my other speakers also who have joined here, and thanks to the organization who have chosen this topic. So let me share my presentation. I hope my screen is visible to everybody. Captain Sunita, can you please confirm with me once before I could move on?
Yes, Merlin, we can see your
Okay.
screen.
Fine, thank you. So a warm welcome and good evening to the team who is listening to us, whom we are not able to see from here. So it's been a very beautiful day, and on a weekend, you guys have planned to listen to this topic, and I'm excited and also feel more responsible to talk about this topic. So my topic for today is transformative leadership, embracing change for macro leading and micromanagement. So in my few slides, I'll be talking more on what is macro leading and micromanaging and how it helps in nursing profession. So this is the first slide talks about a scenario. So this scenario, you can see the picture. It's there. You can see a confused nurse who is standing there. Actually, what is her confusion? Her confusion is actually while checking vital signs for the patient, she found there is some change in the vital signs of the patient. For example, I am giving a situation. The patient has gone into her hypoglycemic event. The patient's hypoglycemia level is around 40. So patient is in second level of hypoglycemia. So she's around 1 year, less than 1 year old nurse. So she is confused what to do now. Whether should she have to call the doctor and then inform and take actions for the patient, or she can just call to the nearby senior nurse who is working next to her and just help the patient, or she can just administer 25% dextrose or 50% dextrose as she wants. So whatever she does, she's just worried what the doctors are going to scold, because patient has gone into level 2 hypoglycemia where she has missed to check the previous RBS of the patient. So she's worried that the patient is going into a bad critical situation. So this, in the short period of time, she's confused and she's thinking, what am I doing here and how can I save the patient here? So this is a small scenario or a situation where any staff nurse or all of us would have gone through this situation at one point of time. And usually these situations are managed by but the nurse has been informed about what is her role and what is her privileges and what is her standing orders to manage any crucial situation or a critical situation. So if she's been aware of what is her role and what she's empowered to do and to manage the situation, she'll be able to do the right thing at the right time. So this confusion state can become an exciting and empowered state where she can save the patient's life. So this is just about a small introduction of how you can make anybody a leader, just keeping things in their pace and empowering them. So before I could talk more on transformational leadership, I would love to talk about transactional leadership as well, because transactional leadership or the traditional leadership is something which is happening for so long. All of a sudden, I cannot just say that in last century, this transformation leadership is growing up, so please follow it up. No, I'm here to tell what is the difference and why we are all talking about transformation leadership and why we are adopting to transformation leadership. So in transactional leadership or the traditional leadership, the leader tells the people what they have to manage and what to do and how to do, and they also supervise, and the employees will comply. They don't have to use their brains at all. The leader will tell, keep this box from this place to another, they will keep it. And here, if the employee does the work wonderfully, so they get rewards. If they're not able to do it, they get punished as well. Now let's move on to transformational leadership. Here, the leader will give the tool and the confidence to take charge and make decision as necessary. So here the team has to work upon them and they have to do what they can do from their side. So here there is lots of inspiration and motivation, and there is a beautiful line of communication which is going on, where everybody are clear about it. So if you could see the difference itself, now we will know why we are talking about transformational leadership and why we are adopting to transformation leadership as well, because it makes that particular person more empowered and willingness to work forward. So let's see some few definitions of all these terms. So transformation leadership, as I already mentioned, it motivates employees to take the ownership, to do their roles and perform beyond expectation. So you call them and say, you are doing a wonderful job, please take up this course and do it. They put their heart and soul and they'll be able to perform well. So that's their transformation leadership definition. Who are transformational leaders? So these leaders are inspirational and they can motivate the employees to find better ways of achieving a goal. Usually they are called as quiet leaders and they always lead by example. So what is transformation leadership in nursing? This is a very important topic and that's the topic of the day as itself. So it motivates nurses to take ownership of their roles and perform beyond the minimum expectation. So you take a staff nurse and then you see her performance. In just 2 years, you're seeing that she's more enthusiastic in doing infection control practices. So as a transformation leader, you're calling her and telling her to be a link nurse. Then in sometimes she becomes an infection control nurse. Then in sometimes she becomes an infection control officer. She moves into quality team and she moves into accreditation. So by this, you are able to transform a person just by identifying their potential. So just a small bedside staff nurse, you are picking up their role and their performance and then asking them to do their beyond minimum expectation. That's the best part in nursing. So there are a few key elements in the transformation leadership in nursing. There are four important things. The first one is inspirational motivation. This usually talks about the vision, what a leader's vision is. Since my next speaker is going to talk more on how a vision you can make it happen, I'm not concentrating more on this particular one topic of inspirational motivation. It just says that you should have the clear vision and you should be able to percolate to others. The second point is individual consideration. So in nursing, we always used to work as a group. So being a transformational leader, you should be able to know each individual's strength and weakness. And we should be able to consider each individual by enhancing their strengths and overcoming their weakness. So that's the second elements of transformational leadership. The third one is intellectual stimulation. So by practicing the traditional method, we feed them so much of information. You just follow the SOP only. Do not do any deviation from this. So that's called, the set rules are already in place, just follow that. That's your traditional leadership. But in transformation leadership, there is a new issue which is popping up. You call the team and give them the group, this is the issue, brainstorm and come with the solution. So when they come with the solution, we tell them to do their work and then they can able to solve by themselves. So we can stimulate their intellectual values and the knowledge and whatever their learning experience, previous learning experience. With that, they will be able to perform and solve the issues better. The last one is idealized influence. It is being a role model. If we have to be a transformation leader, we should be the role model of what we talk. So these are the four important key elements in transformation leadership. Any new things which is coming up or anything, we always see advantages and disadvantages as well. So there are 5 important advantages. There are more, but I've just chosen 5 important ones. First point is, it helps in job satisfaction. So as in transformation leadership, we pick up the best person to do the task and we encourage them to do it. And once the outcome, we give them credit. This is what every employee needs as well. So once their work is recognized, they feel satisfied in the job, whatever they are doing. So it actually fosters the high job satisfaction. And the second point is higher level of employee morale. So there is a study which was done and people have found that when there is a very strict situation which is happening and the people are not satisfied, the employees are not satisfied, even their health condition goes bad. But in a very healthy work environment, when people are asked to, when people are empowered to do their work, they can give the best out of it and people stay with their integrity, whatever they are doing. The third one is, ultimately, this all takes up to the patient safety. So in a healthcare, this is the first thing we want. So any actions, anything we do, it should ultimately lead to the patient safety and the patient outcome. So when an employee is really satisfied and when conscience and responsibility of what they are doing, ultimately it will land up in the best patient safety and the overall outcome also will improve. Third one, it stimulates creativity. This one I have already told in the elements. So when a new solution, when a new issue is given, and we ask them to give their possible solutions, lots of solutions and lot of intellectual activity, brainstorming happens. So this will encourage them and it stimulates creativity, brings motivation and enthusiasm to the workplace. So we'll move on to disadvantages. There are disadvantages as well. It can create high rates of burnout sometimes. So when we keep motivating people so much and they keep working on certain things for a long time, their focus is only to complete that particular work and just move on, and they become more responsible, where at one point of time people can become burnout. So it is the leader's responsibility to give them break and understand what is their level of involvement in the job. Make sure we also give them breaks, give some nice activities in between, take them outing and do things like that, so their burnout levels can come down. And leads to overlooking reality. Sometimes we feel very strong about our team without knowing their strengths and weakness. So the leader thinks that, yes, I've told to my team they are going to do a wonderful job, where they won't be able to take up so much. So we have to understand the team first and then we have to work. And the third one is sometimes considered unidirectional and unidirectional, because people will keep on working and not knowing what is coming on the other way. So it is very important to people to understand both the ways. What we are throwing is also coming back to us. So these are the few disadvantages where we can overcome, and we can enjoy the advantages of transformational leadership. We are moving to the next segment of what are the key traits, what are the characteristics of a transformational leadership. Before I could talk about nursing, I would like to tell a small history or a story, not exactly story, this is an history what happened. In 1961, the American president, John F. Kennedy, he has taken the responsibility of being a president. He's been elected as a president. So during his visit to everywhere, he also visited NASA. So when he went there, he was asking the team about their objective. What are you doing? What is the next 5-year plan, 3-year plan? So they gave so much of objectives, like in 3 years, I'll be able to expand my department. In 5 years, I'll be able to make the best satellite to take these informations to the space. And I will make the maybe AI into it. So many different things they were giving. And John F. Kennedy just finishing all the visit, and he just said, I'm going to give one objective for the NASA for the next 10 years. It's not 3 years or 5 years, for the next 10 years. So a leader is envisioned and understood the team, and he's telling, in next 10 years, in this decade, we are going to send a person to moon, and we are going to bring that person back to the earth safely. It's a very simple objective. He has given the timeline. He has told what we are supposed. It's not just going to moon. It is coming back to the earth safely is also inclusive in it. So for the next 10 years, the NASA was working on everything, whatever the objective was included in this, and they were working so hard. And this vision was told to everybody in the department. Like the HOD of the NASA also says that, what is your objective? I have to send a person to moon and bring the person back to earth safely. Till the janitor says that I clean this room and keep it neat so that the people can work hard, so that they can send the person to moon and bring back the person back to the earth safely. So everybody were focused on one particular objective, and everybody were doing their part very importantly, and they know what they're supposed to do. To be surprised, he gave 10 years of time, but then in 1969 itself, just 1 year before, they were able to send people to moon, and they came back safely to earth also. There are a few conspiracy theories. I'm not going into it, but this is a history which has been placed. So anything you want to envision, and just tell your clear objective to people, and people will start working on it. But the objective should be very clear, and it should be told to people very easily. And the leader has to take that responsibility of sharing that information to the right people at the right time. So now we'll come to the nursing and what are the traits we are supposed to see here. So first of all, the effective communication. You'll be able to correlate all the traits with the story what I have mentioned just in time. So in nursing, for example, there is a fall which is happening in my department continuously. In every month, I'm having 2 inpatient fall, which is leading to very bad deviation in my quality indicator, and also the patient safety is also compromised, where all of us are worried. So first of all, the nursing head or the team leader, whoever is taking care of it, should be able to effectively communicate to people what they want. So it is not one-way communication. It should be a two-way communication. The leader is proposing what they want, and the team, if they are confused and they are feeling that there is something wrong in this particular objective, I don't think we'll be able to achieve it, or how to achieve it, rather than sitting and thinking that somewhere someone will do it, it's better always the other side also they ask questions. So the effective communication means it's a two-way communication. And the next point is create inspiration for a shared vision. So our objective should be reliable, and it is not very grandiose. It should be achievable as well. And we have to share that vision, whatever we have. Third one, becoming a model for the change that you want to see. Not only by saying, our actions also should speak what we are trying to convey to people. Allowing others to become actively involved. For example, as I mentioned already, fall. So we have already proposed that the fall is happening. So what are we supposed to do? So we are asking everybody to give inputs, how we can make this possible. So we have to find out the root cause. What is the most important reason for this fall? So we identify that fall is happening during the lean time, by evening 7 p.m. to morning 7 a.m., where the nursing staffs are less and even the manpower is less, and it's a rest period. So patient wants to go to the washroom and they get slip and fall off. Patients are able to move their side rails on their own because the cots are little rusted and it's an old cot, and it is not functioning as it's supposed to be functioning. The attender is going for dinner early, so the patients are unattended in the rooms. So you find out small reasons and allow the others to become actively involved so that they can give suggestions how we can overcome it. For example, for the cot problem, you can do a cot audit all over the hospital and find out where is the issue. And the lean hours, you can keep champions during the nights to go and visit the vulnerable patients very often and make sure their safety measures has been followed or not. So we can take few inputs like this and we'll be able to achieve what we are supposed to achieve. Willingness to challenge the process. Always risk taking is very important. So we should not stick on to whatever we are already following. Just go one step ahead and allow us to take risk, and we'll be able to achieve great things. Set high expectations and demonstrate measures to achieve goals. And at last, demonstrate the competency in nursing practice. So these are the 7 important traits of a successful transformational leaders in nursing. So we have spoken about elements, traits, advantages, and disadvantages. Now let's move on to what are the actions. And here I would like to talk about another subtopic of mine as macro managing and micro leading. We always focus on macro managing, but then in nursing, when we are taking care of very new joinees, like less than 1 year nurses, we have to focus on micro leading as well, because they don't know what they are doing. Just giving them the chance of you can go and do everything, they will get stuck. So in 100% while leading a team, maybe we can put 20 to 30% on micro leading, and the major part should be on macro leading. So I'm going to tell few actions which will more focus on how these actions have created impact. Maybe there are few examples which I'm going to say. Those things will tell how much it has helped me to become a leader in nursing as well. And those are all macro leading experiences. So the action 1 is offering support and recognition. This is not a very new term. This is always repeated everywhere. So when you want to appreciate someone, please appreciate in the crowd. And when we want to punish or correct someone, always do it in the closed room, which will make one person's self-esteem really high. And that will always help them to perform really well. So the real life example is when I joined as a staff nurse in the Burns ICU at CMC Vellore. I stay at Chennai and Vellore. We have 4 hours of traveling time. So I usually don't go home every often. I wanted to club my leaves together. So here I usually, I don't ask for leave very often, but then I have always told my in-charge nurse that when you're rostering, if you want to have adjust with anybody, please adjust me only. So if senior nurse wants a night shift to be shifted and she wants to pre-pon and she asks me, I'll say, okay. They want to change the duty, okay. They want to do the week off later, I'll be saying, okay. So any duty change or anything, just call Merlin. This is their one-time solution. And I'm always ready to do that also. This is a small support which I was able to offer. And they recognized in a way that my in-charge nurse, whenever she's roasting, she'll make sure that my leaves are clubbed together so that I can go back home and come back. So this is the recognition what I got. This is a very simple thing, but during, as a very small, maybe 20, 21-year-old girl, always want to go home and with homesick, this small support was very helpful. And I feel it is as a reward for myself. This also helped me to get along with all my senior nurses, and they were very cooperative with me throughout my 2 years of nursing practice. So being a transformation leader, we should be able to recognize, and we have to offer support to that small needs of that particular person, which will really, you can get the good impact of that particular action as well. The second action is practicing integrity. Integrity is, the word is very small, but then it is a decision to do the right thing even when no one is watching us. It is actually little very tough thing, but then being a transformation leader, following integrity matters a lot, because people are watching us as a role model. So they will feel that anytime I go, this is the answer I'm going to get. I cannot do any shortcuts with that particular person. So the real life experience, what I would like to say is, after finishing my master's, I was in training and development group, during which the training of senior nurses, in charges and above, was difficult for us. We are not able to complete our mandatory training hours of 4 hours for the in charges and above, because they were always involved in administration of the ward, and they feel like, no, I'm not coming for the training classes. So it's easy for us to just write the numbers, attendance, take the attendance, and we can give it up. But our head was very clear that no cheating anywhere. Training is mandatory and they should be able to do it. So we forced ourselves and what to do next. So what we said was, we can have a 4 hours continuous training activity on the weekends, like Saturday post lunch, you can just come, and then you can, the topics are not same as the other nurses. This is mostly on management with lots of activities. So they were able to gain management skill as well, and they were able to finish their 1 month of training activity in just one day. So with this, we were able to complete it is a win-win situation. You also get gained, I also get gained, but our integrity has not gone anywhere. So people started looking at us like, we cannot fake all these things. Let us go finish this training program in one stretch and go ahead. So that created that this training team is not faking. They are always sticking on to whatever they are doing it. So this is the second important action, that we have to practice integrity in whatever we are doing. The third action is inspiring others to look beyond the self-interest. Self-interest is a very important term nowadays. Everybody are talking like self-love, self-interest, it's me everywhere. But then in nursing, being a transformation leader, we have to always make the other person to look beyond the self-interest. So it really matters. So here I can give another example. So I was around 6 to 7 months old nurse in the ward, and I'm supposed to administer injection heparin 5,000 international units subcutaneous to my patient at 11 a.m. in the morning. So I went to the fridge, I took the medication, went to the medication preparation area, loaded. I was about to administer to the patient, during which one of my senior staff nurse, her name is Miss Sophie. Still I remember, because she has created a very good impact to me. So she just came and told me, Merlin, just come here. Then I said, I have to administer medication. She said, it's okay, just to the medication preparation area. She asked me, what have you loaded? I said, it's injection heparin. She said, look at the vial. When I looked at the vial, it is injection human act rapid, because both the vial looks the same there. Just imagine diabetic patient with, the patient would have gone into hypoglycemia. So thank God nothing happened on that particular day. And the senior nurse was very good enough to just take me away from the situation, making sure the patient safety is also ensured. She didn't make any big scene there. She just called me, she corrected me. I started crying there. So that was a very beautiful impact which she created on me. Since then, it is my practice that whenever I'm administering the medication, I read thrice the label before administering the patient, because that's what's taught to me when I was in this nursing school, which I missed once I became little confident in my nursing profession. But she inspired me, telling that I'm not going to tell to anybody, because if she's going to tell, of course she's get the credit from my in charge nurse saying that she has proved her leadership there. But then she made sure that I'm not affected anywhere, but made sure I learned a lesson as well. So she was just for on more than her interest, she was always helping me to understand that whatever you're doing should be perfect. So she created a very impact, and I'm still following that practice anywhere I go. The fourth action is inspiring motivation. So whatever we teach, whatever we talk, we should practice that in our own life itself. So there is another example here. One of my teacher during my nursing school only taught me that before administering your antihypertensive drug, make sure you check the patient's vitals. Yes, we all do that, and then we administer. But after administering the drug, after 1 hour, check the BP again and inform the patient that your blood pressure has come down to this level. So that will make the patient happy, and he also feels that this medication is working for me. Actually, it looks very simple, but during my schooling, I was feeling really happy that we are trying to tell people that how this action is helping you, this medication is helping you, so that the person can follow taking up that medication properly. So, and it has become a practice also, and my teacher makes sure that she does that always. So to everybody she teaches that, and when we are in the clinical practice, she makes sure that we follow this also. So what we teach, we do it, and that will create a great impact on anybody. Action 5 is celebrating the small wins. This always gives a very good impact on anybody. Even a small move of that, this one project from phase 1 to phase 2, you celebrate, people will feel really happy. And it is always good when we celebrate as a team. So that will encourage people to do more. For example, any accreditation we win, even if it is in.
So Malin has given us a very good insight of all her examples and live situations of every day with how they motivate the nurses and all her own experiences as well, and also the advantages and the key traits. I think every leader would be able to follow. And should we go to the next session? We now go ahead with. I think I'll just give a little brief of Dr. Urmila Bharadwaj. Professor Urmila Devi Bharadwaj is presently working as a dean at SNSR Shraddha University. She is having 41 years of teaching experience, and she has worked in Jamai Hamdard, New Delhi as principal. She got a Lifetime Achievement Award from Samaj Vikas Sansthan Meerut for a contribution to promoting rural and urban community health. She is certified in corporate social responsibility by the government of NCT. She has experience in nursing administration as nursing superintendent at Holy Family Hospital and Majidia Hospital, New Delhi. Her area of interest is nursing research, community health nursing, nursing education, nursing management, women and child health, adolescent health, and women empowerment. So Dr. Urmila has got a very vast experience, and she's also authored 3 books, like she said, Biosciences, Anatomy and Physiology in Micro, and also Nursing Education Technology, as well as Comprehensive Procedures Manual. So ma'am has got many years of experience in nursing as a great leader, and I'm sure she will put insight into the topic. And over to you, ma'am.
Very good evening to all of you. Thanks, Captain Sunita, to give my brief. I'm actually more pressured and threatened to be hearing about me. It is too much. And I'm also thankful to InnovatioCuris, Sanjay sir, who has really given a platform for us to speak about nursing on this platform. You know, recently the world had witnessed a global pandemic, which has made the health scenario upside down. It has challenged people's health on a big platform, as well as the economic, social, and every aspects of life of people has been influenced by this. And nursing has been really giving its best to take care of the patients, take care of the people in the community, and all those things. So in recent years to come, I envisage that nursing is going to make a big change in health scenario in the world. And our government of India has recognized it, and they have really made nursing a big thing, making new nursing colleges, making so many projects for nursing. So coming to that, I'm also grateful to the previous speaker who has spoken about transformational leadership, which actually has is my work. So here I am to speak about transformational leadership. For the sake of just having a background, leadership is defined as sometimes as a personality trait or a quality which causes others to follow, comply, or be persuaded to be the leader's point of view. It is nowadays not required because the things has been changing, and sometimes as a power relationships and sometimes a process. There are various theories of leadership which we have, but today we are going to concentrate on transformational theory, which is the need of the hour now. There are situational theories where in a situation you practice different kind of a trade, and there is a environment in which you take decisions that what kind of a leadership style are you going to adopt. But now we are talking about the transformational theory, which is being more talked and which is required in nursing, I feel, because in olden times when I was trained, this was not talked about. And people are coming with lot of individual enthusiasm, individual, their own capabilities. So it is required to change the leadership practice as well. This theory, transformational theory, recognizes that multiple intangible exist whenever people interact with each other. Factors such as sense of meaning, creativity, inspiration, and vision all are involved in creating a sense of mission that exceeds good interpersonal relationships and rewards. See, before we practice any of leadership style or any of these things, we should know what are the strengths, what are the weakness, what are the opportunity, and what are the threats or challenges of that particular situation. Now, the leadership qualities, whatever style we adopt, whether it is autocratic, situational, or authoritarian, whatever, we have to have these qualities in us. So integrity is very important. People will only believe the leaders who are having this trait. Courage, leaders should have a courage to take decisions, take the good and bad of their decisions, and take initiative, be energetic all the time. That is how you will influence your followers or your employees or your mentees. Well-roundedness. You should know everything what you're talking about, what you're practicing. Perseverance, coping skills. Many times you have failure, you have stresses. So the leader should know himself or herself how to cope up with the things. Otherwise, you will end up with having your own problems and percolating into your employees or your people. And optimism. Always think positive. Be optimized. That will also influence your employees or your student or your mentees how to cope up with life. And then self-knowledge is, of course, always, because knowledge is your power. So that is most important. The behavior which usually leaders have to behave, they might have to direct, sometimes coordinate with the other staff development and supervision. Now, today's topic, transformational and transactional leadership. Ms. Merlin has talked very nicely about transactional and transformational leadership. So I'm just going to speak about transformational in detail. The central question is, how do leaders create and sustain change? Because there is nothing permanent than a change. Change has to occur all day, in and out, every minute of our life. So we have to see how we sustain a change, create and sustain a change. What style of leadership is needed to motivate people to undertake change? Because change is feared also. Most of the time, if there is a change, people, resist to it. They don't like to change. They like to remain in the same. So how to motivate? Because change is a must. It is mandatory. So what style is needed to motivate people to undertake this change? So the ability to get people to want to change and to lead a change. That how you can transform people, and that is a transformational leader will do. I'm deliberately not talking about employees or anything. I'm talking about mentors, because I know for my own experience, then when you're a mentor, you can really make a change. So I'm deliberately using the word mentors. Leadership is an intangible quality with no definition. I like, because then when you define, then you're constrained. You fix up your boundaries. So I like this quote, Adam's leadership definition, that with no definition, that's probably a good thing, because if the people being led knew the definition, they would hunt down their leaders and kill them. If they know the definition that you are fixed in that particular thing. So there are dreadful leaders who demean their followers, or they demean their mentees. Wonderful leaders elevate the followers. In wonderful leaders, the self is not there. Only the motive is that who are your followers, you elevate. It's a selfless. So wonderful leaders are selfless. They elevate their followers, and they always, thrive for elevating their followers. Recognize the smartest person in the room rather than act like you're the smartest person. If you are a leader, many a times the leader says, I'm the smartest one. But that's not a transformational leadership. It will be that you recognize who is the smartest person in the room. To take people to places they would not have gone by themselves, and get them to do things they otherwise would not do have, because they want to do it or they understand why it is so. So leadership is pivotal. It is everything. Your quality, your patient care, your every activity is surrounding around the leadership. The mentees or the followers will always be around the leadership. How the leadership consistently predicts employee, student, their attitude, motivation, how are they performing, and how well-being they are, because their well-being is much more important. If they are well, they're able to do things, they will automatically, with less of a effort, they will do the best things. So uh, my previous speaker has already spoken about these things. I'll speak in, like, there are 4 I's: idealized influence, inspirational motivation, individualized considerations, and intellectual stimulation. She has talked some of it. I'll just say for sake of doing. We can have on the continuum passive and active leadership, effective and ineffective. So if you have transformational leadership, management by exception, contingent reward, you become effective leader. And if you have laissez-faire, like leave up to them whatever they want, it will be ineffective. The key to developing people is to catch them doing something right. This was the one, that when they are doing something right, you catch them and then reward them at that time. Not that all the time you are finding fault with them. So when you want to develop people, catch them when they're doing something right. And then when they don't do, you have to, as very rightly said by the previous speaker, that then if you have to got something they do wrong, do it in personal. Praise them in public and correct them in private. So full range of leadership, contingent rewards, constructive transactions, immediate and specific feedback, management by exception, corrective transactions, and when standards are not met, has active and a passive form, laissez-faire, and then no leadership at all. Then no changes will take place. a word about it, that if you're trained to practice transformational leadership, it's coming up. So many courses are there in India. India, I don't know how much, but abroad there are many courses being run for nurses for transformational leadership. So if you're trained, definitely your performance, your followers' performance is going to raise. And if you're not trained, it will go down. Same way, if you're pre-trained, then your performance will definitely be better. Now, let us say in what is idealized influence. Be a positive role model. When I read this many times, and I remember an example of our beloved president, Dr. APJ Abdul Kalam. And when I read him, when he failed, he's one of the projects in SLV failed. And in a press conference with his team, he said, "It is my failure because I could not lead them properly." And same project, when it became successful, in this press conference, he again said, "It is my team who did it. I had a very little role to play." So this is what a positive role model would be. Then the team, during the process of any failure or anything happens, they will not be demotivated. And when they achieve something, they will be motivated. That's a good example of a being role model. Then lead by example. You yourself, if you are wanting your team to be in time, you have to be in time. You cannot, it is not an era when people take your words. People observe your gestures, your own this thing. So whatever you say, you have to really set an example. If you say you be like this, you have to be there. Very good example, if a leader says be in time, and he or she herself is late, the followers will not follow. They will find some way to escape. So lead by example, be confident. And when can you be confident? When you are very, very perfect, sincere, and selfless mission, goals, then you be confident. Be energetic all the time and engaging and respectful during interactions. When you are interacting with people, please be respectful. Do not demean anybody and engage with their capabilities. Instead of being so critical about everything, you have to really be very respectful to them. Inspirational motivation, very important, and inspirational vision one has to have. Then only if you have a good vision, then only one can inspire. So I have an example of Lord Krishna when he was giving a Gita to Arjun. He had a vision, and Arjun, his follower, has lost everything. He didn't want to fight. He said it's better not to, be defeated than to kill so many people. He was totally hopeless. But see the great motivation given by the Lord Krishna in the time of stress and strain he had gone through, that he could inspire him to fight and to win. So that kind of a motivation, inspirational motivation, has to be given by a transformational leader. You can motivate people with your inspiration. And the leader has to have a very clear vision. Lord Krishna had a very clear vision that he has to fight and he has to win. So that is how the leaders of today, when we want in nursing, we have to have motivate. Because when nursing is dealing with life and death, we come every minute, every second of our life is going through some kind of a challenge. And how to cope up with this challenge, we have to be motivated. So that is what a transformational leader will do, to motivate nurses at every time of challenge they face. Encourage mentees to leave their comfort zones and explore their abilities. You have to instill in them that they believe in their capabilities. They are, motivated enough, and they understand, yeah, I'm capable enough. I can do that. That has to be instilled in the followers. Let mentees know that you believe in them. See, if the leader says you can't do it, you're hopeless, they will go down 100 times more than they would have been otherwise. So tell them that yes, you believe in them. Challenge mentees to set meaningful and challenging goals and promote personal growth. Promote their personal growth. and challenge them that you can do and you can achieve your goals, whatever is being said. Intellectual stimulation is very, very important. We believe, and I believe it very strongly, that everybody has intellectual power to, face any situation, but there has to be somebody who can stimulate them. So it is the role of a leader that you stimulate them intellectually. Encouragement is to tackle old problems in a new ways. The problem which was there, if one option has not worked, let us find out what is the next option, what is the new way, and try that. Inspire mentees to think critically about their ways of doing things and to share new ideas. They think critically themselves. You don't have to give them cooked food to eat. No, inspire them that they take their own decisions, critically analyze their way, how they had been doing, and what is new we can help mentees develop their own creative solutions to them. The leader is only helping them. The solutions has to come from the person itself and help them that what creative problems they have. And I tell you, every individual has lot of capabilities. God has given us by birth to have lot of capabilities, which we are not using so much. So we have to, ignite into that. Like Lord Krishna has ignited Arjuna that you are so capable, you can do anything. And then he did. So that is how we have individualized consideration. Every individual is different. Value that individual. Listen to them carefully. Giving a listening ear itself solves many of the problems. Give specific personalized feedback and advice that suits to that particular person. So individualized influence take place when leaders foster trust and respect among others and model ethically desirable behaviors through the demonstration of personally held belief. Behave as a role model, as I already said, do what is right and not what is convenient. The leader should never do the things which is convenient, which is for his or herself, should never do those things. Should do what is right. Create trust and respect. Consistent and dependable. You cannot change every time. Be consistent in your behavior and be dependable. And if you make a mistake, don't be afraid to apologize. It does miracle. If you have done some mistake, never mind, apologize to that. It does miracle to the mental well-being of the people who are followed. So Rick Hansen had idealized influence. He had said, you believe in something, you stand up for it, you try to pull together a team of people who can be inspired by that same vision, and then help encourage people to add value by putting their unique talents to the task. And you treat everybody with respect, no matter what role they treat everybody with respect. Identify potential challenges and don't say, I don't have a time, I'm in a hurry, I'm going for a meeting. I've seen many people, and it does happen because sometimes something more important is being worked. But give 2 seconds. At this point of a time, I'm busy. If it is very urgent, tell me. Otherwise, I'll come back. And come back and talk to that person, because that person will say, oh, now she may not have even time. Come back and give him the time or the other time and brainstorm possible. We are always in a hurry, and hospital is a place where a lot of activities goes on and we are always busy. But give time, tell them that you are not in a hurry. This person is the most important. And if you are not able to give that time, come back and make sure that this person is comfortable to have another time. Brainstorm possible solutions and schedule your calendar. That way you ensure allocate the time to each and every person. Their personal inspirational motivation, I have already said. See, there will be expectations of leader, expectation of the self. So raise the expectation of the self. The leaders will always have expectations, but expectation from the self of the mentee, raise that. Convince others that you can achieve beyond expectations. Tell them that yes, even if this is the expectation of yours, you can always achieve more than. Be optimistic and enthusiastic about what can be achieved. Set high standards. Set your standards, set your goal higher. I believe in you. It does miracle. If you say somebody, I believe in you, you can do it. You are the best. If you give this kind of positive strokes to a person, it is definitely going to do Very. Let mentees know you believe in them. Like encourage your mentee when they have doubts about their capabilities. Be enthusiastic and never, if a leader is not having energy, not enthusiastic, demotivated, what will you percolate among your followers, among your students, among your colleagues? So you have to always be encouraging, be enthusiastic yourself, and percolate. Give this to your mentee. The goal setting has to be such, it has to be smart goal setting. That means the goal should be very specific, which can be measured, which can be attained, which should be relevant, and it has to be time bound. So make sure that the goal setting is very, very smart. Intellectual stimulation involves encouraging others to see issues from multiple perspectives, not only one. Your vision has to be wide. You have to be very visionary in making things and questions their own others, commonly held assumption. Acknowledge your mentees' difficulties and challenges. If they have a difficulty and challenge, I have heard many people say, why you have a problem? Everybody else is fine. Why you are doing this? No, everybody perceives things in different way. I have heard many people, why you have a problem? Why every day you are doing this? Why are you late every day? Go into the depth of the thing, find out and try to find out the solution. Try to brainstorm potential strategies. They have so much of a potential. Use that potential. Maybe in a particular area, she's not able to give her full potentialities. Give some other, do the brainstorming and find out where she can give her best. Discuss alternatives and challenge your mentee. Man's mind stretched to a new idea never goes back to its origin. So we are always open. The man mind is too vast and we can take many things, many dimensions, and we never go back to the same. Identify potential challenges. My mentees say that physical social activities aren't for them and they just can't see the benefits. Brainstorm, find the possible solutions and provide them the scientific. It is an era of scientific evidence. Anything we talk, we just can't talk like that. We have to have evidence, proof of everything. So when you are talking, you should have a scientific evidence as a transformational leader. I tell you, this is an era of information explosion. Everyone has access to all kind of information. The leader should have a scientific evidence when we do talk to our employees. Individualized consideration takes place when leaders respond to the personal and psychological needs of the others and display a genuine sense of care and concern. Listen, display empathy and compassion. Very, very important. I was just reading recently when I was doing transformational leadership, something word like compassionate leadership has come. Okay, transformational is there that you don't have self-less, you motivate people for change and arouse them, their potentials. But along with that, attend them sincerely, understand them and empathize with them. And empathy doesn't stop there. You empathize and whatever is the problem, help them. That is very important. So in compassionate leadership, we are adding helping them. So I liked it. Compassionate leadership also be a part of nursing because there are a lot of problems, a lot of things, a lot of challenges in their professional life as well as their personal, family, and society at large. So we should be able to help within our boundaries. Maybe we cannot. Somebody says, I will never do night duty. We cannot at times, but we should try to help them how best we can do that. Recognize mentees' psychological and physical needs and ability. Like somebody doing a shift continuously night, they may be exhausted. So you have to recognize that what is causing them this kind of exhaustion and try to help. Display genuine care and concern. See, human psychology is very, very complex and very important. People can understand, are you genuinely concerned or are you saying just like that? So you have to display genuine care and concern to them. Then only you're doing individualized consideration. It was not just ability or good manners or physical appearance, but a genuine capacity for empathy, for interest in himself, in the circumstances of other people. Then identify challenges. Given the limited time, money is always constrained, time is a constraint, so we have all resources which are never in abundance. Whatever money, time, resource you have, within those resources, we have to support the mentees active brainstorm and possible solution to that. I like this PPT because God has created so much of human beings. But fingerprints of each individual is different. Every individual has different fingerprints. How beautifully he has created. Same is with the human mind. The human mind is different, and every individual, because if their mind is different, they will think differently, they will act differently. So we have to take that clue from God's creation that every individual is different. So treat each mentee as a unique and valued individual. Okay, so you cannot have one solution for all. Study your mentee, study your followers, study your employees, study your student in depth, and then see what is the individual need of it. And individual difference has to be kept in mind. Few things will be general, and individual is much more important. So thank your mentee, work on them, do a exhaustive work, and find out what are the opinions can be given to this particular individual. Listen carefully. And if you can give somebody a time or your listening ear, your full attention is really give to that person that you are attending. I had seen many a times, if only you listen, you are not giving any solution, you are not maybe able to solve the problem, but give a listening ear, 50% of the problem is. And many a times people, I never had believed in closed door, this thing, whether I was in hospital or in a academia. I have never had a philosophy of closed door. Nobody can enter. People will come through my PA, people will come through my PA. No, anybody can come to my room without any problem. And I tell you, they come with fighting with the complaining of teacher, complaining this, complaining that. And I only give a good list. 50% they are happy, they smile, and their problem is gone. Rest 50 has to be taken care. So you can really, with full attention, full genuine this thing, and I would not only listen and leave at that. If there is a genuine problem, I'll genuinely try to solve it. So that faith is also being built. That is very, very listening carefully is very, very. At the end, I want to say that learning is a change in behavior. As we have learned in education that it is not education, it is not learning if the change in behavior has not taken. So whatever we learn, we have to make change in our behavior. SMART goals we have done already. These are the few examples of some academia where you can have transformational leadership. Like in nursing strategic plan, every activity, personalized patient, evidence-based practice, and transformational leadership and development. Everything has a evidence base. It's very important. This is an era where you cannot speak without any evidence. That is why creating an evidence, meaning thereby doing research, creating an evidence is very, very important. And the leadership, which is based on facts, evidence, it is much more effective. So create a leadership model that provide current and further future leadership environment, tools, evidence, and development to innovative, transformational during the time of healthcare reforms and the transition. Quality goals. So the transformational leadership, it will be focused on transformational leadership at all levels, establish a quality learning system so that nurses at all levels throughout do have access to the measurement and feedback about innovative care delivery. When we are talking about professional practice model, professionalism and leadership. Professionalism is very, very important. In nursing, it is very strongly given in our academic preparation, be a degree, diploma, post PG or whatever. The professionalism is very, very strongly interwoven in the academy. So the transformational leader creates a compelling picture to the future that inspires and catalyzes people and multidisciplinary teams to realize their full potential. Through trust and engagement, the transformational leaders foster a passion for excellence, continuous improvement, achievement of shared goals, and the pursuit of innovative breakthroughs. So we have in each aspect of nursing, whether you are, I'm just winding up, whether we are in any type of nursing practice, teaching, mentoring, practice, anywhere, the transformational leadership is a must. And I tell you, if I think of futuristic nursing, lot of many changes are going to, and we have to cope up with those changes as the medical technology is advancing very fast. The social, things are changing, economic at the worldwide, and we are not working at our local level, national level. We are working at an international level. Nursing has become an international profession, and we should be preparing our mentees, our people to be in any situation. I'm sure in India, with great leadership of our Prime Minister, Shri Narendra Modi ji, the profession of nursing is going to see a great paradigm shift. I have seen in Uttar Pradesh, Yogi ji is making a lot of transformations, lot of things, and Professor Lavanya knows about it. A lot of things are being done. So in future, I expect that the nursing profession is going to get higher and higher things to be done, higher professional things to be done, and we will reach the sky. Every individual has its own goals, professional, personal, and I wish all the best to all my professional coming budding nurses for their best. And I'm also wishing all the best for InnovatioCuris team to, give us a platform to speak to all those people. And I wish all the best. And thank you so much.
Thank you very much, Dr. Urmila. You gave us extensive detail about transformative leadership and translating your vision into reality. And I'm sure, for taking a cue from this, we are going as with your guidance and your leadership. And like some of the points, I really felt like you catch them doing something right and reward them. So, and also like you have to lead by example. So all of us, I'm sure we'll take these valuable suggestions and your advice from you, ma'am, and we will go forward as leaders and see this profession reaches greater heights. So can I call on Merlin if she is available to be giving a remaining part of her presentation on transformational leadership, embracing change for macro leading and micro managing. I think you were doing a beautiful job. I'm so sorry that it was like we had to interrupt, but can we go ahead with this, Merlin?
Ma'am, I just have one last slide because most of the thing Urmila ma'am has covered it. So I just wanted to close my last remarks. I'll just share the last slide alone. It'll take maybe 1 minute of time for me to just talk about it, and let's close it.
Sure, please go ahead.
So with addition to whatever Urmila ma'am was saying and my previous talk also, this is a story. I recently had a travel to Bhutan. So during which this was a story which was kept in all the important places and keeps reminding people about the story. Actually, they were telling the story for humanity and respecting each other. But when this topic came and I was going through the story also, I thought, let me put it in transformational leadership as well. So this story of Bhutan says that they are called 4 friends of Bhutan actually. So there are 4 animals in the story: the elephant, monkey, rabbit, and a bird. So they say a bird was bringing a seed and it doesn't know what to do with it, and it was just going around and thinking what to do, during which the rabbit said, let me dug a hole and then I will place the seed there. So rabbit did its work of digging a hole and then they placed the seed there, and the monkey said, let me put some manure to the seed so that it grows well, during which the elephant came and said that let me give a shade and let me pour some water also for it so that it grows well. So in some time, all 4 people have done their work, and the tree has grown really well, and the fruits started bearing fruit, and everybody were enjoying the fruit coming from the tree. So this actually shows that each person has their own capability of doing some task, which will give fruits, which will be benefit for everybody. So in transformational leadership, as a leader, we should focus on the team, what was given to us, and what is their capability of doing that particular task. delegate the assigned task to everybody and tell that you are doing well every time they do the task well. And at last, in the hospital sector, it's always patient safety. And when the patient gets discharged and say, thank you for taking care of me, that's the fruit which we are bearing out of it. So with this, I'm closing my talk, and thanks for the opportunity, ma'am. Once again, you came back to me to complete my talk. So thank you for everybody for your patient listening.
Thank you very much, Malin. I think this was really brief and very meaningful. And with this, we as leaders, I'm sure we have made, an edge over the others. We have influenced our juniors and our employees, our students in different capacities. And I think the future generations are going to see successful leaders like Merlin and Ma'am Urmila as well. So I'm so glad that I could share this platform along with you. And it was a pleasure knowing Dr. Urmila as well as Merlin. And I would also like to thank Professor Lavanya and Surgeon Rear Admiral VK Singh, Managing Director, InnovatioCuris Private Limited. I'm really grateful that we got this opportunity, and for nursing, actually, there are very limited platforms where we as leaders come together, and we come together for a common goal where we know the burning problems that are issues that are there and the challenges which are ahead of us. But I think with a collective leadership, with all of you together, I'm sure we can reach greater heights and we take this profession forward. And also guide our juniors through motivating, rewarding, giving them the best from our side, and making them feel valued and respected for the job that is done by them. So all the best. Thank you very much, Lavanya. And I hand over to Lavanya for the word of thanks. Thank you so much.
Thank you. Thank you so much, Captain Sunita. It was wonderfully moderated, and we could not identify that it's already 1.5 hours is over. It's 6:30. Thank you, and thanks to both the speakers. They spoke their heart, and I think a wonderful experience, and the storytelling from both the ends. It was very good. No one was bored to listen to transformation leadership. Just to add one word here, that we all know leadership is an action, not a position. So there is one statistics, one research has been done, like that is a Great Indian Resignation statistics. When we look at that, 58% of the employees of the organization, they leave in India because of the toxic boss. So this is something so important. People who are leading at the top level should really go back and think over this, that there's so much to do. So transformation leadership is one arena where it can change all these challenges. There's a long way to go in India for the transformation leadership in nursing. So let's go back. Let's go back and look back and see what changes can we do in our organization. With this note, I would like to thank Captain Sunita Fernandez for agreeing to be a moderator of today and doing it so beautifully. Thank you so much, ma'am. And I'm thankful to Marlene Gayatri. She really spoke her experience, as a leader she is performing in her organization. So much human in her talk. Thank you, Marlene. For bringing up so many stories, real stories, your experience. We are thankful to you for your time. And I'm thankful to Dr. Urmila Bharadwaj, madam, as she has such a rich experience. So I think I consider as a small child in front of you, ma'am. Thank you for bringing up a lot of experience here. And getting up at 3 o'clock and speaking from USA, that is another thing which we really appreciate you for today's webinar. And thanks to all the audience and the members of IC Nursing Forum who have joined with us. We have some guests also. We are thankful to them for their time. And at late evening, they are still with us. And at last, I would like to thank Surgeon R. Admiral VK Singh, sir, Managing Director, for giving us this platform and making nursing as a core point in a medical profession. He wants to see nursing growing, and it is leading. Thank you so much, sir, for bringing up this nursing forum. And definitely we all together can make a change. And thanks to all the team like Mr. Sanjay and other team members who worked for a long time, almost since 1 month, the people are working on this. Thank you so much once again, and have a great day and great evening. Thank you so much. Good night.